So when you realize that oxidation causes all disease, or is all disease actually, then you have to ask, well, what causes oxidation? And what causes oxidation are toxins. I knew from already personal experience in the clinic, as well as from reading, that vitamin C given IV was able to neutralize any toxin.
You know, you've written extensively about hydrogen peroxide, and I really wanted to know. I was told that, there are a lot of harmful effects from nebulizing hydrogen peroxide. Could you explain to me what exactly happens when you nebulize hydrogen peroxide? What are its benefits? What are the harmful effects? I am going to ask you about some of the harmful effects as well. We're back with Dr. Thomas Levy after a wonderful episode on the power of vitamin C. Today we're going to discuss Doctor's new book, Toxins, the Cause of All Diseases. Thank you, Doctor, for another episode. I'm sure it's going to be wonderful. The book, though, Toxins, the Cause of All Diseases.
Well, it sounds like an exaggeration. Anytime in biology or science you say something is 100%, it's always an exaggeration, maybe 93, maybe 95. Toxins cause all disease is not an exaggeration because, as we mentioned in our last little discussion, all disease, anytime you have a cell in your body that is abnormal, has a disease, or is part of a tissue that has a disease.
It could be genetic as well, right?
Well, genetic is a contributing factor to predisposing some tissues to oxidation, but it's still the oxidation that is the disease. So a genetic predisposition, you might not have enough of a certain enzyme so that something doesn't function correctly, but the abnormality, the clinical abnormality, comes from more biomolecules being oxidized, nothing else. So when you realize that oxidation causes all disease, or is all disease actually, I should correct myself, then you have to ask, well, what causes oxidation? And what causes oxidation are toxins. We have a word in the literature called pro-oxidant, which means oxidizes, antioxidant, which means brings you back to normal, and all pro-oxidants are toxins. All toxins are pro-oxidant. So we like to think of toxins in very graphic terms, being poison.
Yeah, well, I was just going to ask you, what encompasses toxins?
What encompasses toxin is anything that causes oxidation is toxin. I struggled with this when I first was with Dr. Huggins some 30 years ago because I knew from already personal experience in the clinic, as well as from reading, that vitamin C given IV was able to neutralize any toxin. Any toxin in the literature was able to neutralize any toxin. And I said, how can one simple molecule like vitamin C neutralize thousands of different things with different chemical compositions, different everything? How can that be? And even though I didn't realize it at the time, I did realize the only way that can be true is if the toxins have a final common denominator. And that final common denominator is they cause toxicity by oxidizing unique arrays of biomolecules. And vitamin C, when it's able to come into the body and give electrons directly to the toxins before they take them away from the biomolecules, the toxin is neutralized. But it had to be something simple, because how else can one small molecule have this type of impact on thousands of different things with thousands of different structures unless it's neutralizing a final common effect? And so that, and so I'll go back there. And thus the title of the book, Toxins Cause All Disease, because oxidation is disease, and the only cause of oxidation is toxin. Okay.
And you've had many success stories with vitamin C. Many success
countless
stories.
My goodness, no, countless. I mean,
could you share could you share a story that really even was surprising even for you?
Well, one very close, ironically enough, I was in Puerto Rico some 6 or 7 years ago. And my wife called from Denver. I was Denver, Colorado at the time. And she had gotten bitten by some sort of insect. But anyway, it rapidly became infected, went up, and her eye was swollen shut because she sent me a picture, showed me it swollen shut. And I mean, I didn't want to panic her, but I immediately thought, my goodness, I don't want her to lose her sight, or don't want to proceed back to the brain. She said, I need IV vitamin C, because that's what we did a lot then. And I said, there's not a plane out of here until tomorrow morning, so I can be there by tomorrow afternoon. I said, but let's do this in the meantime. Now, mind you, this is important. She was already been taking for several days maximal doses of antibiotics, several different antibiotics. She was also taking some vitamin C, all right? And I immediately knew how powerful the liposome vitamin C was that we talked about. So I said, we're going to hit it, and we're going to hit it hard. I said, I want you now, and it was like late in the morning, I want you to take 5 packets every hour, every hour, every hour, every hour until you go to bed tonight. And so first thing in the morning, she takes a picture, and the eye is starting to open up. So I said, okay, we're on top of it. We've turned the corner, and it's coming around. But the point is vitamin C did that when maximal antibiotics was allowing it to continue. So that's one of many different stories, but it's a continued picture, and it doesn't change. All this is kind of funny too. Sometimes people will say, well, that's what you believe. I said, no, that's what I've scientifically concluded. Belief is religion. I'm not talking about a religion. I don't believe in vitamin C like it's something religious that I should worship. Okay, this is real science based on real data that's been completely ignored by mainstream medicine. I told you before, 80,000 articles in the literature and zero mention of vitamin C for either its effect on toxins or for its effect on infections in the textbooks of medicine. So, no, vitamin C will never fail you. That sounds like a bold statement, but we know like with real estate, what do they say are the 3 most important factors in real estate? Location, location, and location. And then they follow that up. What are the 3 most important factors in French cooking? They butter, butter, and butter.
Butter.
Well, I added to that. I said, what are the 3 most important factors in vitamin C therapy? And the answer is dose, dose, and dose. If you don't give enough, you don't get the result. You'll always get somebody better, but if you can push on, you'll make your way through just about any acute infectious disease and any acute toxin exposure when you give enough and you continue it. Especially when you take protocols. See, this is another thing that mainstream medicine does to us. It doesn't let us use vitamin C in the hospital so that you can infuse it steady state for 24 hours. We have to give it all in one big dose in the clinic. And in fact, when you can give smaller doses more frequently around the clock, like every 6 hours for 24 hours, you get even a better effect and more dramatically. But so that's where we stand there. Toxins cause all disease, and it's not even a close call. It's very clear cut. It's not a religion. It's pure science. And what we mentioned in the previous time too is then where do the toxins come from? Nearly all the time, the most significant ones for your health come from some area of infection. Some area, not necessarily, a flu or something like that, or a cold, but ongoing pockets of infection, most commonly in the mouth. There are other places you can have those infections in the gut and elsewhere, but they're most common.
Why do you say mouth, Doc? I'm confused because I haven't heard that before. Not often. No one, oral health is like the last thing you think about. You brush your teeth in the morning, you brush your teeth at night, and that's about, you hate going to the dentist. And that's as much oral health we follow. But this focus that you seem to be saying a lot, watch your oral health, is something very new that I'm listening to. So you're saying that how does it affect how does it
Sure.
lead to chronic?
Well, I wrote a book specifically on this called Hidden Epidemic. Hidden Epidemic, the fact that occult infections in your mouth cause really all heart attacks and most breast cancers. And the data is overwhelming, ignored, but overwhelming. For example, Samantha, in the coronary artery, the artery that supplies blood to the heart, that when you block it off, you get a heart attack. In patients with known heart blockages, okay, where they did angiograms on those patients and they did something called atherectomy, it's like an arterial roto-rooter. They actually went in there and scraped the plaque out and then analyzed the plaque, analyzed the blockage. Well, in 38 out of 38 patients, I like to say that's pretty close to 100%, right? In 38 out of 38 patients, they found over 50 different oral pathogens, virus, bacteria, protozoa, and fungi. 50 different types inside those plaques. Okay, so the coronary artery should be sterile. All right, but what happens is every time you chew on an infected tooth, root canal or an abscessed tooth, right, into your bloodstream.
Draining into your bloodstream.
That's right. And then, so we know that now for heart. What's even more, or at least equally depressing to me, because probably the emails that I get more commonly than anything else from around the world is poor women of all ages, okay, saying, I've got breast cancer, or it's metastatic, or this, that, or the other. Should I take vitamin C? I say, of course you should take vitamin C, but you also need to identify the elephant in the living room, okay, that you're ignoring. Because all cancers in the breast, 100%, start because you collect pathogens from the mouth inside the breast. And in larger breasts, it's even worse because you need to clear out the lymph. You need to drain the lymph into the breast and then continue to move it out. When it doesn't move out, the oxidative stress comes high, and then you start to develop malignancies. I wrote a paper on this. It's got over 250 different references. It's on my website, tomlevymd.com. The documentation is there. You know, this threatens so much money. There are dentists called endodontists, and all they do is root canal. And the primary reason for this, what I'm talking about, is root canal. The title of the article is Root Canals Cause Breast Cancer Frequent. Not the only cause. But anybody who has just a lump in the breast, any sort of pathology in the breast, the first thing to do is take care of the mouth. I mean, if you want to put it sort of like the breasts are the
When you say take care of the mouth, what I want
to say is the breasts are the drainage source for the mouth. And I think most of us know that the mouth is one of the germ-wise nastiest places in your body. They got them all there. But what makes the bad germs? What makes the bad germs are when your gums become infected, and then they go down to the root tip, and then they involve an abscess or an infection in the middle of the tooth, then that tooth is dead. That tooth is dead, and all it's going to do is poison you for the rest of your life, however long that is, until you take it out properly. But it's same thing with thyroid disease. So many people with thyroid. Where is the thyroid gland? Right here, draining everything from your mouth. Okay. And the purpose of the lymph nodes that often get inflamed when you start draining this is to try to sterilize the lymph. But when you take so much pathogens in it 24/7, then the lymph nodes can't overcome that, and then they become enlarged and finally become sources of cancer themselves. And we know that these pathogens are present, this is in the article as well, in the tissue of every cancer you could find. No matter where the cancer is, when you actually take the tissue and properly either culture it or analyze it for pathogen-related DNA, it's all positive. Cancers do not spontaneously appear for no reason at all. They're always due to very increased oxidative stress, which virtually always occurs when you have a pocket of pathogens sitting in a spot, not getting mobilized and continuing to produce highly potent pro-oxidants and toxins. So, and what did I just say too? I said, so the mouth pathogens cause virtually all heart attacks and the vast majority of breast cancer. Well, guess what? Those two things kill a majority of the people on the planet every year. Just those two things, breast cancer and heart attacks. So the mouth should never be ignored. And like you already said earlier, nobody likes the dentist. I understand. I'll give advice to people and say, well, you need to do this, 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 and this, and this, and you need to go to the dentist. But can I take this? Yeah, you can take that.
That was my next question. How do I fix my mouth at home? How do I do it?
Right. It's kind of like that. But can I take this and not go to the dentist? No. No.
So you're saying that there also could be infections that have no symptoms, that show no symptoms.
That's right. And that's really the big point of the book, Hidden Epidemic, is because the information about root canals has been known for over a century. Okay. A doctor by the name of Weston Price in the early part of the last century did a lot of work with root canal treated teeth and showed they all were highly toxic, etc. Well, in this case, and this has not been well recognized, I don't believe until I wrote the book, because it was sitting there in the literature and nobody was paying attention to it, is many teeth, as you get older, hey, everything deteriorates as you get older. So you can split a tooth or get a cavity or this, that, or the other. It doesn't hurt, but it allows bacteria inside the tooth. And once any bacteria get inside the tooth is gone and you form an abscess. But it's asymptomatic. It can totally destroy your health, diabetes, high blood pressure, cancer, arthritis, everything. But you don't know it's there.
No.
And that's why we talked the last time about getting a test done.
Could you mention the test again?
The test is a cone beam examination of the mouth, a computed tomography.
I'm not sure if that's available in India.
Oh, yeah. Yes, yeah, it is.
It is?
Oh, absolutely.
Okay. So
I mean, not all dentists have it, but it's there. It's also called the 3D X-ray. Sometimes they call it that.
Oh, okay. Yeah.
Right.
I haven't heard cone beam, but the 3D, yeah.
Cone beam, right. Computed tomography, cone beam, right. But it's incredibly detailed test and revealing lots of pathology that you don't suspect is there. But the thing is like when sometimes people say, well, I don't know. And I said, well, look, when's the last time you or a friend of yours went to the doctor, and as you walked in the room, the doctor's eyes opened wide and said, oh, my God, you've got a blood sugar of 325. Let's treat it right away. No, you've got no idea that the blood sugar is 325 in an asymptomatic person until you just do it as a routine test. Okay. And so when somebody walks into the office and the doctor says, oh, wow, you've got 3 abscessed teeth that are causing all your problems, but nothing hurts. Well, you don't know until you do the test. So the cone beam exam is something I recommend for everybody as a baseline. Okay. Because even if you're feeling well, it's good to know the state of your teeth.
As a preventive measure.
Right. And then let's say 5 years, 10 years, 15 years down the line, you start to get diabetes, or your blood pressure goes up, or you get any of the many reasons for which they slam you with prescription medicines and do nothing else. You need to repeat this test and make sure you haven't abscessed a few teeth. Interestingly enough, a good friend of mine, who was the reason why I wrote this book, because it was her teeth that are on the cover. She had a lot of root canals, and they all came out, and she did great, and had the cone beam, and everything else was fine. And then, lo and behold, 10, 12 years later, she calls me and says, hi, doctor found a couple lumps in my breast. And I said, well, time to repeat the cone beam examination. And she repeated the cone beam examination, and 2 more teeth had become abscessed. So that was what was causing the problem, and they had to come out. I mean, nobody wants to lose teeth, but I think even less people want to have cancer and heart attacks and premature death. So Dr. Huggins used to sarcastically tell me, what's more important to you, you're keeping your tooth or keeping your health. So that's where we stand there.
Say you find an infection in your mouth. So how does one get rid of it?
Well, if the tooth is infected, the tooth has to be extracted. There's, to date, maybe, I don't know what'll happen 20 years from now with technology, but when Dr. Huggins first started doing this, he had dentists from across the country that extracted root canals, send them all to a Dr. Boyd Haley at the University of Kentucky to test for toxin. And Dr. Haley devised a wonderful test that looked at 5 different prominent enzymes in the body, and over 5,000 teeth, 100% of them had highly potent toxins. And there were a few teeth that were taken out for what's called orthodontic reasons, normal teeth. Those had no toxin. The point being is, once infection gets inside the tooth, it destroys the matrix of the tooth, and the tooth, even though it can still function as you chew on it, it's a dead tooth, and it's going to do nothing but contribute to long-term poor health in just about every way imaginable. Matter of fact, the gums, when they become infected, in the literature, for many years now, every disease you can think of correlates to poor gums. So, I mean, which means that the gums are the ones that end up providing the pathogens that affect the tooth. So an infected tooth can cause most diseases and literally make all of them worse. And the other thing too, all right, you're swallowing these pathogens all the time, and then people get what's called chronic pathogen colonization in their nose and throat. That's what we had talked about in the past, that you use hydrogen peroxide nebulization to get rid of. Why? Because
I get into a lot of trouble for that.
Well, the truth hurts a lot of people. The truth hurts a lot of people. You can cut that out.
No, Doc. It was very stupid of me to get ahead of myself. I got a little excited, and I put that up simply because, well, I used to carry the strip of amoxicillin in my bag. Every single bag had a strip of amoxicillin, because I travel a lot for work, and every time I move from one city to another city, like clockwork, I will get sick. I will get an infection, and I will have to start antibiotics. I will have to start amoxicillin. So I remembered that I had changed my bag, and I found that strip, and I realized I haven't gotten an infection in a long, long time. And I was also taking care of a friend of mine in the hospital, and something like that, being in the hospital and being around a sick person, would have immediately made me sick, but that didn't happen as well. And the only thing I was doing was nebulizing hydrogen peroxide. So, I got ahead of myself, and I put that out there, and I know that it was absolutely wrong, that I should have added a disclaimer, consult your doctor. But for someone I got a lot of hate for it. And rightly so, but I still want to know, you've written extensively about hydrogen peroxide, and I really wanted to know more. Yeah, yes. I wanted to know. I was told that, there are a lot of harmful effects from nebulizing hydrogen peroxide. Could you explain to me what exactly happens when you nebulize hydrogen peroxide? What are its benefits? What are the harmful effects? I am going to ask you about some of the harmful effects as well. But before that, could you explain hydrogen peroxide?
Unlike prescription drugs, I might add, hydrogen peroxide, when used and dosed correctly, has no side effects, at least no toxic side effects. There's a statistic out there that shows that 100,000 people in the United States die every year, not only from prescription drugs, but from prescription drugs taken appropriately and precisely as prescribed, not taken in some crazy fashion. That's how toxic they are. Hydrogen peroxide, little quick chemistry lesson here. Hydrogen peroxide is naturally produced in your body. It's not an alien molecule in your body. Matter of fact,
it's naturally produced in my body.
Absolutely. You have water, H2O, you have oxygen, O2, and you have hydrogen peroxide, H2O2. It's your body's natural antibiotic. Matter of fact, when every breath you inhale has some pathogens in it. Okay. Hopefully not enough to cause an infection, but everywhere. And guess what? The epithelial cells lining your lungs and lining your airways make and secrete hydrogen peroxide into the airspace to deal with those pathogens. So it's your body's natural response to pathogens to make available hydrogen peroxide to kill those pathogens. So every time you nebulize hydrogen peroxide, all you're doing is augmenting the body's natural response. Number two, so many drugs and antibiotics break down into horrible, toxic side products, or metabolic byproducts. After hydrogen peroxide kills a pathogen, you know what's left behind? Water and oxygen. So you immediately hydrate the tissue and you oxygenate the tissue, which are the two most important circumstances for healing damaged tissue from an infection. So the hydrogen peroxide not only knocks out the pathogen, but also leaves the tissue in the perfect environment for healing. I mean, it's absolutely a treatment divine in nature. I mean, if you're religious, it's God-given. If not, it's nature-given, but it's the most perfect bodily response to a toxin you can come up to an infection that you can come up with.
What about lung pneumonitis? What about damage?
Okay, the good point. Let me say this. If there's no pathogens present, you don't have a cold, you don't have anything there, and you start nebulizing peroxide, it'll probably cause some irritation, and you'll sneeze, and you'll cough, and this, that, and the other. Well, you don't continue it then, okay? It's there to kill the pathogens, not as some sort of special sauce to make your lungs feel good. It's out there to kill the pathogen. And a lot of people, let's say they already have a cold, or they already have stuffed up. When they first nebulize peroxide, they feel fine, they breathe better, no problem. And then, either in a day or two, or even quicker, all the pathogens are gone, then it starts to irritate them. Well, that's because the peroxide does have an oxidizing effect. That's how it's killing the pathogens. And if the pathogens are gone, and you continue to press on the peroxide and it's causing irritation, well, you got to stop. Okay, it's a common sense type thing. But the point is it's there to kill the pathogens. And the other thing too is, especially patients with COVID, we found out early on in 2020, as you probably know, I'm sure you know, many people were getting severely short of breath, and they'd get on the respirator and then they die, or they wouldn't make their way to the respirator. Hydrogen peroxide nebulization is like a nasal cannula. I mean, it will immediately increase your blood oxygenation. And if you put an oximeter on your finger, and let's say you're running 91, 92, which is getting a little low, and then you nebulize with the peroxide, within a minute, you'll see it go up to 93, 94, 95. So it's like what I call a poor man's nasal cannula, something that you don't need to run to the hospital to get. And oftentimes, just a few points in the oxygen goes a long way in giving you symptomatic relief and relief of your syndrome. Now, generally speaking, you go with 3% if you tolerate it. Some people, no problem at all. Others, very sensitive, so you dilute it in half, or you dilute it down to 1.5, or you dilute it down to 0.075. Just dilute down as you need. But bear in mind that the closer to 3% that you can get, the quicker you're going to get over whatever it is you're dealing with. So the other thing I found is, and this was perhaps as amazing as anything else, the book is called Rapid Virus Recovery. I almost called the book Rapid Gut Recovery because it cleans out the pharynx so completely, even when you feel normal, okay? Sometimes you had a cold a year ago, and now you have a chronic pathogen there, even though you don't know they're there, and it's covered by a biofilm, which antibiotics cannot penetrate. But you come along with peroxide nebulization, you knock out the biofilm, you knock out the pathogens, and guess what? You stop swallowing pathogens 24/7. You stop swallowing their metabolic byproducts. Next thing you know, you've normalized the gut. And bowel movements get regularized. You don't no longer have a leaky gut. Remember, when we started here, all disease is oxidation. And that applies to the gut too. And if you're swallowing products that oxidize, you're going to cause toxicity to the gut. I've had a couple patients. One started nebulization when he had Crohn's disease, which is considered to be a lifelong incurable disease. And he'd had it for a year and a half. He was bedridden, multiple drugs. Anyway, within a few months, he was completely normal, back to school, athletic, everything else. Black mold. Another lady said her whole family had black mold poisoning, bought a new house, kids were in the intensive care unit, almost died. They started nebulizing. They were fine within a couple nebulizations. You have to stop something where it's developing. So many things in the gut are directed at symptoms. Like I'm causing diarrhea, so I'll have to take an anti-diarrhea. Constipation, I'll take a laxative. Upset stomach, I'll take an antacid. Nothing is addressing why you got those conditions. And why you got those conditions is you're swallowing pathogens and toxins that something like hydrogen peroxide can knock out. And when you normalize your gut, Samantha, everything else in your body gets better. I'm sure you hear all the talk these days, all the conferences. They're all talking about the microbiome in the gut and the leaky gut and fungus and everything. That all goes away when you nebulize hydrogen peroxide correctly. Now, unlike vitamin C, which has no toxicity, every other thing has toxicity. 90% hydrogen peroxide is literally rocket fuel. And 30% hydrogen peroxide will burn the daylights out of your skin if you get a drop on it. So what? Everything is toxic if you take it in the wrong fashion. Taken this way, it only mimics and endorses the body's natural mechanism in defense against infection.
Thank you for that explanation, Doctor. Even I needed it. So coming back to, the importance, you've clearly established the importance of good oral health. I mean, you have driven that one home. So if apart from, starting with oral health, what else should one be doing to get rid of the toxins from the body?
Well, it's a big topic, so this is not a comprehensive coverage of that, obviously. But so you've addressed the mouth. Let's say you've addressed the mouth.
Do a series. Yeah.
Absolutely. Address the mouth. Many of us have heavy metal stores, and we talked earlier that everybody should be on some form of chelation, not necessarily intravenous chelation or intravenous heavy metal removal.
Maybe an EDTA supplement.
Supplement. Yeah, a good one is that taken. It helps a lot. And the other thing too is one of the other now main toxins that so many people are faced with, I think hundreds of millions personally, is the chronic spike protein from the chronic COVID and in many patients from the vaccination, which is designed to put spike protein in the body, and people get the spike protein and they can't get rid of it. And it causes all sort of toxic problems. So again, but it's a toxic issue, toxic from the mouth, toxic stored in the tissue, toxic from this unfortunate pandemic that's put so many people in a desperate situation. So while there are many things to do, I've put together, I don't sell it, this is not a money-making thing, but I put together a combination of supplements that over the past year, the feedback is just working wonders. It's cut into 2, 4, 8 supplements. 4 of them do one thing, 4 of them do the other thing. The first 4 bring calcium levels down inside the cell, which cause all oxidative stress. And those are vitamin C, vitamin D3, magnesium, and vitamin K2. Each one of those agents by itself, Samantha, decreases all-cause mortality. That means each one of those things, if you just take it and nothing else, you decrease your chances of dying from anything, not just one particular disease or heart disease or cancer, anything. Now, the vitamin C should be multi-gram. We've talked about dose before, probably somewhere, depending on the person, between 3 and 9 grams a day. And if they have a lot of chronic problems, you just talk about the problems that you have easily getting infections. That's a classical reason why people are adrenally insufficient. They get infections easily. So being able, with the help of your physician, of course, getting a prescription for 5, 10, 15 milligrams of hydrocortisone a day with the vitamin C, great. Number 2, vitamin D3, which is very important. Most people, 5,000 units a day. Magnesium, very difficult to get the levels up in your body. So you got to do this as best you can because magnesium is as important as anything at all in improving your health and maintaining health.
But Doc, isn't there like magnesium oxide, magnesium citrate?
Many different types.
So many. So which one do I choose?
My general recommendation, they're all going to supply magnesium. So I'm not saying anything bad about the other ones, but the two ones that I support the most are the liposome encapsulated form I live on, which is a little pricier, but good. And the other is one of the cheapest things you can possibly take, available just about in any drugstore, in any barrio or poor place in the world, magnesium chloride. And magnesium chloride is especially important because, unlike the other forms of magnesium, the chloride with the magnesium is a powerful, powerful, powerful anti-pathogen by itself. Okay, magnesium chloride in the 1940s was given by a doctor by the name of Dr. Nouveau in France. And he gave babies and young adults with polio just magnesium chloride solution and cured them all in 1 to 5 days, just like Dr. Klenner did in the United States with vitamin C. So in the setting where they are right now of still having COVID out there and still having other viruses out there, my general advice is to take the form as magnesium chloride. But you can take multiple forms too, but the magnesium chloride is cheap and easy and has this anti-pathogen effect. So that would be my recommendation there. Now, the second 4, very significant too.
The first 4, let me just
all right.
recap that one. So that's magnesium, vitamin D3, K2, and vitamin C.
Yes. And those all bring calcium down, bring magnesium up, bring vitamin C into your cells. You'll never have a normal cell free of disease until you get the vitamin C level inside it normal. The other thing you need normal inside your cell, which the vitamin C will lead to, is normal ATP production inside your mitochondria. ATP is the energy molecule in your body. I think most people have heard of it.
Adenosine triphosphate.
That's right. Okay. It's made in the mitochondria. Guarantee you, if you're low on ATP, you're low on energy. If you're high on ATP, you got energy. It's that simple. How do you stimulate that? They have something, I need to go into great detail, it's called the electron transport chain in the mitochondria, where basically, remember electrons, it's all about electrons, right? So the glucose from insulin comes into your body, goes through something called the Krebs cycle inside the cell, all designed to start electron donation to 4 steps of what's called the electron transport chain, which when you get to the final step, you make a lot of ATP. The 4 steps are, the first one is NAD, nicotinamide adenine dinucleotide. The second one is FAD, flavin adenine dinucleotide. The third step is coenzyme Q10. And the 4th step is an enzyme called cytochrome B oxidase. Now, that said then, with any reaction, any chemical reaction, how do you keep the chemical reaction going? By giving lots of substrate, by making sure that each one of those 4 steps has plenty of substance to work on, which means low NAD. Lots of talk about NAD these days, NAD supplements. The best way to bring your NAD up sky high is by taking vitamin B3, niacin or niacinamide, in multi-gram doses. Again, they usually say take 10 milligrams. No. You need multigram, 1,000. That gives you lots of NAD. Matter of fact, niacin.
What about N-acetylcysteine?
That's another good supplement that helps make glutathione inside your cells. And I would hasten to say that when I'm talking about these 8, I'm not saying there aren't many other good supplements. But most people, for both a comfort, ease, and pocketbook, can't take an indefinite number of these things. But the NAD, when you stimulate the NAD high, Dr. Abram Hoffer back in the 1970s was able to cure chronic schizophrenia with high doses of niacinamide. Cure. So that's how important this is. So you get the NAD. The second step, the FAD, guess what? Vitamin B2, riboflavin, 400 milligrams a day. The third step, coenzyme Q10, incredibly important, a little pricier, but incredibly important supplement, good to take at least 600, 700, 800 milligrams a day. And finally, the fourth step, I think you've heard of this, Samantha, methylene blue comes in and contributes to
controversial.
It gives an
Why
electron.
is it controversial?
Well, anything that's going to displace a pharmaceutical or lessen its prescription is going to be controversial. So don't think that nobody, or at least in the healthcare industry, nobody wants to see a $5 cure for cancer. No, they don't want that, and they will do everything to oppose it, no matter how solid the science is. I'm not saying $5 of methylene blue is going to cure your cancer, but it's going to do a lot of great things because it's a powerful antioxidant. It brings the electron in at that last stage. But when you take all 8 of these supplements... Is it all about the
dosage?
The dosage, generally speaking, should be probably about 20 to 25 milligrams. It comes in a 1 cc solution and a little dropper full. 1 cc is 10 milligrams, 2 cc's is 20 milligrams. Many different ways to take it. Got to be careful because it's easy to stain things with it. I finally found the easiest way to do it is just open it and squirt it on the back of your throat. It's bitter for a few moments and then it's gone. Rather than mix it up in stuff and then splash that stuff on the counter and then you have a blue speckled counter for the rest of your life. It's a pain in the butt. But
what
very, very, very powerful.
What does methylene blue do exactly?
I'm sorry?
What does methylene blue do exactly?
Methylene blue, excellent question, is an antioxidant that basically has the same clinical profile as vitamin C. I mean, it absolutely does everything that vitamin C does, interestingly enough. And in some cases, even a little bit better. I mean, can you believe that? All this stuff I've written about vitamin C, and I'm going to tell you that methylene blue does things a few bit better. Matter of fact,
that's a shock.
If you're going to do one thing, and one thing only, which I wouldn't recommend, of course, and you start to notice a sore throat or something like that, taking several squirts of methylene blue is going to bring you around a whole lot quicker than the vitamin C. But obviously, you want to do it all. You want to do that, vitamin C, hydrogen peroxide, and you'll be over it very, very, very quickly. The methylene blue, it's important to note, it's 1% solution, and it's got to be pharmaceutical grade. You'll find large amounts of methylene blue that are real cheap. Well, those are used as dyes and not meant to be taken in. But 1% pharmaceutical grade, and that's what you're shooting for. This is also good, Samantha, for young kids with tonsil problems. You get big inflamed tonsils long before they ever get a tonsillectomy. Just have mama put a drop or two of methylene blue on each tonsil for maybe a week or so, and you'd be amazed how many of those tonsils completely resolve because methylene blue is just taken up like a sponge and goes throughout the tonsil.
1% pharmaceutical grade.
Right, 1% pharmaceutical grade.
And you've been mighty kind to offer your email ID to be added to this podcast in case the listeners have doubts, that they are free to email you.
Sure.
And you would be happy to reply. And I think that's extremely kind of you, doctor, because sometimes just in a podcast you don't get enough and sometimes people need a little extra help. And It's absolutely wonderfully kind of you to offer your email ID to be added to the link on this podcast.
Well, I have a packet of information, and I mean, my physical books are sold, but I give away many of the ebooks. I give away the Rapid Virus Recovery ebook and the Hidden Epidemic, Death by Calcium, Magnesium Reversing Disease. I give away all of those that has all this information I'm talking about, and an extensive number of articles that go into this more deeply. So I'm happy to do that, but I can't do consults. So people say, well, I've got this, and this. What do I do? I'll lead you in a direction to find a doc, but I'm not going to do a consultation with you online. But I welcome the emails. I have an Instagram account too, Dr. Thomas Levy, Dr. Thomas Levy, and the website, tomlevymd.com. So I'm, the information is worthless unless people find out about it. So I mean that I'm not trying to give myself any praise or anything else like that, but my goal is to help as many people as possible. All right. And anybody that wants to oppose me on that can go to hell.
Straight to hell, is it?
Yeah.
Well, that's, I shouldn't probably reply to that. But thank you so much, Doctor. This was another amazing episode, and there's so much clarity. There's so much actionable steps to be taken. You just don't leave us scared, but you actually have given us steps to take care of our health better and improve the quality of our life. And we're really grateful, in this age to have this kind of information, to have access to this kind of information is truly such a gift. And I'm grateful to you. I'm grateful that you took out the time to do this. Thank you so much, Doctor.
My pleasure, Samantha. Anytime. There's a lot more we can cover and a lot more people we can help. And I admire and respect your willingness to use your celebrity to help as many people as you can. It's admirable.
I'll be seeing you very soon, I'm sure.
All right.
Thank you, Doctor.